be diving into the examination and interview process. So one thing I've noticed that every single place I apply to always asks, they always ask you, why do you want to work? Like if it's a pharmaceutical industry, they'll tell you, why did you choose industry? Why do you want to work here? They'll always ask you this question. But let me break it down into the three sectors I applied to. First, you have to think about, if for pharmaceutical industry, what I noticed that they asked me, okay, for the examination, because that was the first thing I did. Examination questions were basically around pharmaceutics. That's farm calc, that's farm calculation if you don't know. It was mostly calculation, conversion. Like then they asked me about the drugs that they produce. I listed about 10 because that's what they said. List about 10 drugs that this company produces. Like the main names though, not just the generic names, the brand names. So you must know what this company does. They also asked me mission and vision statement of the company. So before you go anywhere, even if it's interview, if it's exam, find out about the company that you're applying to. They will most likely ask you things about that company specifically. So for pharmaceutical industry, I applied to like 3, I think. Or was it 4? Yes. So most of the questions were around the company, who founded this, blah blah blah. Then calculation. That was what my questions were basically about. So for hospital, it was mostly a patient is blah blah blah. They were just trying to test your knowledge of pharmacology. So I can't really help you here, but you should just read about it. Then read about that hospital. What are they well known for? Read about their mission and vision too. Read about who founded that hospital. This hospital, whatever thing is known for, find it out. There are some hospitals that are specifically known for this type of surgery. Find it out too. The common drugs, they always ask the drugs. I know they always ask in every interview. They always ask you malaria drugs, like very common drugs. The scenarios, they won't start asking you about a weird syndrome. That's the one thing I've noticed though. Maybe I was just lucky, but the places, read about anything you can get your hands on, read on it too, because they will always ask you. Then for community pharmacy, it's just basically clinical questions, like pharmacology questions that they will ask you. They barely ask anything about the community pharmacy. They just ask you a few questions just to understand where your knowledge is. Then conversion for dispensary too. Okay, they also asked that for hospital. That was all basically, I think. Then interview, they'll ask you, why did you choose this sector? Why did you choose this sector? Why do you want to study in this sector? Why did you also choose them too? They also ask that question. They also ask you why, where do you see yourself in 5 years? They'll ask you, wait, let me think. So they'll ask you, where do you see yourself in 5 years? They'll ask you, why did you choose this sector of pharmacy to specialize in for the 1 year? They'll ask you, why did you choose their own company? They want so that you have to actually lie. Just make it look like your goal is to work here. Always interview process, always make sure that you're specifying that it's an honor for you to work here. You have always dreamed about working here. This is one thing that I think that gave me my pass in every interview I went for. Always pretend, even if that's not what you really want and that's like your fallback plan. Pretend like it's an honor to be there. Another thing I want to say is your dressing. I said it in the last process. Your dressing, dress like in Nigeria, we're in a country where it's dressed how you want to be addressed. Dress properly. If you fix nails, please remove those nails, because in hospital and industry, they'll still not let you wear nails. So you cannot be giving them a precept that you're going to be a difficult problem. So please, if your nails are long, go and remove it. Don't deceive yourself. Playtime is over. If you have lashes on and it's too precarious, if it's too obvious, please just remove it. It's old people that are going to be interviewing you. Old people are judgmental, whether you like it or not. They're going to judge you. So please, and first impression matters. So dress well, remove nails, lashes. If you're a guy, trim your beard a little, like look organized, look like you should be working with them, look like you bring value. Please, they're going to judge you first before any other thing. So another thing I wanted to say is, most of the times in these places, they'll normally leave you in the waiting room purposely and be watching you. If they have security cameras, this happened in 2 talking about certain things. So they were telling me about how they purposely kept us there and was watching us in the camera. So some places when you go there, they will delay you purposely and be watching your body language. Don't go and start pressing your phone, especially if you're waiting for an exam or waiting for interview. Please, sit down, just look organized, keep revising, but don't start pressing your phone, don't start slouching, don't start doing like you're irritated, don't start complaining. Even if the other people are complaining, pretend that you're happy and you're okay with it. I never really asked all this conquer and ecology question. It was mostly things that you should know, like malaria drugs, malaria scenarios, diabetes scenarios, malaria, diabetes, high blood pressure, what else did they ask? High blood pressure living, like common things we see. So they asked and basic things. That's what they basically asked this video. I guess we're almost done with our internship thing. So the other videos are going to be posted on my TikTok, and I'm going to see you in the next video.